Thank you, Grace, for the kind introduction. Yeah. Good morning, everyone. Can I have my first slide, please? Okay. What happens is that over the next 25 minutes or so, I'll try to share with you how you can benefit from using the knee braces, all right? How to optimize your footwear, your shoes, insoles, and about knee supplements for your knee pain. First of all, is what are old knees? Old knees, basically, the most common condition is knee osteoarthritis. In Mandarin, basically, is 关节退化. All right. So it's a very common degenerative disorder. What happens is that as your knee wear down, the cartilage wear down, the part of the bone that is undergoing a lot of stress, basically there will be bone cyst formation underneath, and around the surrounding area where there are lesser stress, there will be overgrowth of bones. So you have bone spurs, 你的骨刺, all right? And what happens at the joint, all right, the knee joint basically will gradually, the joint space will narrow down, so 你的那个关节慢慢的变小, okay? And surrounding the joint tissue, basically you will harden up with scarring and hardening. 你就会比较硬化, okay? And what are the risk factors? Basically, it can be genetics, inherited in your genes, runs in your family. Female, 就是妇女们，你们的这个几率患这个退化的几率也比较高 ，OK？ And obesity 就是体重超重，你的这个关节，然后就要承受更大的压力，那么退化的速度也比较快。And also advancing age, basically it's more wear and tear. So the other cause of osteoarthritis is if there is any preceding knee injury, 就是如果你的关节有受到什么损伤的话，那么它的这个退化就也会比较快 ，okay? Or knee infection or any other insults. So what happens is that knee osteoarthritis tend to affect the inner knee compartment, 就是内面的内侧的这个关节 and also behind the kneecap. What happens is that sometimes you'll get pain, especially stiffness when you get up from chairs, starting to walk, or when you climb stairs or go downstairs. Basically you get pain, and then sometimes you also get grating sound when you bend and straighten your knee. Also, sometimes you may get swelling, jamming of the knee. Then surrounding muscles, especially the muscles in front of the thigh, the quadriceps muscles, may waist down, and there will be progressive loss of movements and also joint deformities. And the most commonly encountered joint deformities is where your knee actually bow outwards. That means 就是你看你的这个关节会慢慢的弯，就是向外侧弯 ，OK？ And in the X-ray, basically, is that on your left, basically, is the X-ray of a normal knee joint. You see the arrows here. You see a normal joint space. Whereas with gradual wear and tear, the cartilage wear down, and you see that the joint space gradually narrow down. All right, and also there will be 骨刺 around here. Okay. So how can you actually benefit from knee braces and guards? How to optimize have appropriate shoes and insoles, and also I also focus on the two main supplements, glucosamine, 就是葡萄胺 and chondroitin. Okay. When you talk about knee braces, there are two types. One is the soft type, basically the fabric knee guard. As you see on the right here, there's two types. And the other type, which is less common, are the rigid type, where you have metal frames around. So when you look at the fabric knee brace, basically most of them are made up of synthetic rubber, fabric material. What they can give is actually it can compress the joint a bit, provide some warmth, keep it warm, and also just a little support. But essentially what it also helps is that it will also give us a better sensation of our knee position, all right? And also when you move your knee, it will give a better feedback and also balance. And it may help relieving the knee pain. Okay, so when you look at the fabric knee guards, essentially in the shop you'll find the two main types. One is, you see, fully closed type, and the other one with a hole, or we call a window knee brace. All right. Now, what are the differences between the two types? Let's look at the closed knee guards first. Generally, basically, it can help to control if your knees is slightly swollen, and it'll be good to help when you're actually walking a lot. All right. And what happens with the closed knee brace is that because it's fully closed in front of the kneecap, all right, it actually compresses the kneecap. And what happens that if you bend your knees more than 45 degrees or so, it will cause increasing pressure behind the knee cap, and you'll find that you may experience pain, more pain in fact, if you climb stairs or if you squat down. That's because of it's also compressing the kneecap. And it's generally not recommended if you have mainly pain behind the kneecap, or when you have pain climbing or stairs or going downstairs. On the other hand, the other type of the knee guard without, basically with the window, it does not compress the kneecap. So what happens is that it actually helps to keep your kneecap in the central rib path, basically keep it central position when you actually bend or extend your knee. All right. So you'll be basically it will be more helpful for people who experience pain, just mainly pain behind the kneecap or have difficulty climbing stairs. So for the fitting of the fabric knee guard, basically is that you must take appropriate measurement around the knee and then refer to the individual sizing chart of the individual brands for optimal fit. Just a reminder, basically this sort of knee brace and knee guard basically is not to be used for prolonged hours, because it not only is it hot, it may irritate the skin, it may also cause your knee to become dependent. Basically is that the surrounding muscles will basically gradually become weaker and waste away. So it's only to be used if you actually have to do a lot of walking, okay? And you can take it out at home. On the other hand, I will just touch briefly on the rigid frame. Basically, it provides much better support. However, on the downside is that it's actually bulky, it's heavy, and it's also costly. And you'll encounter this type of knee brace mainly being prescribed by your doctors or therapists for specific knee conditions. But however, I just want to mention briefly about this unloading knee brace is because if you actually experience pain, for example, mainly in the inner knee compartment, sometimes this unloaded knee brace may help by reducing the stress on the inner knee compartment. Mainly, basically, this type of brace works by 3 leverage points. So you can see F1 here, F2 and 3. So basically, the 3 leverage points, one is on the knee, all right, and the other 2 is on the lower thigh and the upper leg, so as to unload. Basically, if it's actually on the pain on the inner side, it will help to reduce the stress on the middle side, you see, by applying. Basically, it's by physics of the deleveraging, all right. So 减少那个内部这个内侧关节的这个压力 ，OK. So next, I just want to touch on is that your whole body, musculoskeletal system, all the joints basically are actually interrelated. What happens is that movement of one joint, all right, will affect the joint that is above and below. So it's actually a dynamic and very kinetic chain. Maybe I just draw, it's pretty similar, like, you have seen train carriages, many carriages, and if what happens is that if one carriage is derailed, right, the rest will run into problem. The whole train carriage will run into problem. So your musculoskeletal system is something like, it's a very, very dynamic kinetic chain. So why I say that is because what happens lower down, below your knee, at the foot and ankle level, will affect your knee. All right, so many of us will experience that if we actually wear a better pair of shoes that provide better support, you'll help to reduce the stress on the knee by absorbing more impact, especially if you are, say, walking on harder surfaces, on the roads and so on. On the other hand, we see that young ladies actually love this high heel shoes. What happens is a high heel basically will increase the pressure behind the knee. Right? So far so that if the heel is above 1.5 inch, the knee pressure has been found to be greater. It will increase the pressure more than 25%. All right. So, I mean, you have experience going down the slope, all right, or walking down a ramp. You see how painful your knee is if your knees is actually there's a problem with your knee. So 你们有就是好像有这个走下斜坡，你就会知道你的这个关节有承受的很大的压力，就是跟穿这个高跟鞋一样 ，OK。The other common condition is basically flat feet, basically 扁平足. What happens is that you see that some of us, if you look at the inner side of the foot, the arch here basically is compromised, is diminished. And what happens is that if you look behind, you find that the whole foot actually rolled inwards, all right, and basically is tilted sideways. And if you look at the footprint of a person with flat feet, you'll find that the footprint is actually much bigger because the arch here is diminished. All right. And why I want to bring up this condition is because what happens is that you remember the kinetic chain, dynamic chain that I mentioned earlier on. So what happens is that if you have flat feet, your feet rolled inwards, your leg will also be rotated inwards. All right, it's an interrelated chain. And what happens is that your knee will be under more stress, all right, and may wear and tear faster. So you'll find that one way to attend to this problem is by providing an arch support insole, and this may help, if you have and to reduce your knee pain. Next is that moving on is that many of us may have this inner knee compartment osteoarthritis. So what happens is that some of us, you may also be able to benefit from insoles that is wedged up a little up on the outer side of the foot. That means the side that is bordering your little toe. So you just wedge up a little bit. What happens is if you do so in the shoes, you will shift the weight, right? The loading stress of your body weight outwards. So in other words, you will shift the stress from the inner knee outwards more towards the outer knee, and you may find that you may be able to benefit from it. All right. So moving on, touching on supplements. There are many brands of dietary supplements available in the market, and many of you will be taking these supplements, and according to studies, over 30% of patients with osteoarthritis use supplements. However, we have to remember that only a few actually have scientific evidence of benefits and long-term safety, and most of them don't have. So in view of this, basically I'll just focus on two that is more widely researched and has scientific evidence. Basically glucosamine and then chondroitin. So what is glucosamine? Basically glucosamine in Chinese is 葡萄胺. Basically is that it's actually the most widely used for osteoarthritis. What happens is it's actually produced from shellfish. It's actually made from the shell of the shellfish, not the meat. And the usual dosage is up to 1.5 gram or 1,500 milligrams daily. Glucosamine basically is essential building block basically for many parts of your knee joint. It includes the cartilage, for the ligaments, tendons, and so on. And what happens is not only is it a building block, basically it can also delay the breakdown of the knee cartilage and also help to rebuild it. So, and some studies also show that it may also have some anti-inflammatory effect. That means it may also cut down, reduce the inflammation. All right. The side effects of glucosamine are usually mild and infrequent. It includes stomach upsets, constipations, diarrhea, headaches, and rashes, but not common. All right. And because glucosamine is derived from shellfish, there's been some concern that people who are allergic to shellfish may be allergic to glucosamine. What are shellfish? Shellfish, that means includes your prawns, crabs, squids, and all those clams, oysters, and so on. So, but actually glucosamine is actually derived more from the shell, not from the meat. So people are allergic mainly because of the meat rather than the shell. So most of the time, it's not a major issue. There is also some concern that glucosamine may worsen diabetes, but actually, according to most studies, it usually doesn't affect the sugar control, especially of the type 2 diabetes. This type 2 basically are the one that elderly people suffer from. And there is also some concerns that glucosamine may interact with some anti-cancer medication. So if you are taking anti-cancer cancer medications, please consult your doctor. Right? Now moving on, chondroitin is, I would say it's a relative of glucosamine. Another is actually a complex sugar that is used for making your cartilage. And chondroitin is actually manufactured from cartilage of cows, pigs, and sharks. Again, building block of your joint, a lot of your joint structures, and the effect is pretty similar to glucosamine. It helps to reduce cartilage breakdown, also stimulates the building of cartilage, and also has some anti-inflammatory properties. The usual dosage is about 800 milligrams to 1.2 gram or 1,200 milligrams a day in divided doses. However, the research study on glucosamine are far less than, on chondroitin are far less than glucosamine. And most of the time, these studies are actually a combination of both glucosamine as well as chondroitin. And we find that actually by adding chondroitin, most of the time you don't get additional benefits if you are already taking glucosamine. All right. And also glucosamine, you have to also be aware of two main things, is that it will interact with the anticoagulation drugs, the warfarin, basically it's a blood thinner, so it's a 保血的药. So if you interact and cause greater risk of bleeding, all right, so you have to try to avoid chondroitin. The other thing is that it may worsen the asthma if you are suffering from asthma, 气喘, all right. So lastly, I'll just round up with just on viscosupplementation. Basically, viscosupplementation is basically injection of the hyaluronic acid into the knee joint, another close relative of glucosamine and chondroitin. What is hyaluronic acid? Basically, is a viscous fluid composed mainly of carbohydrate that is in your joint, and it acts as a lubricant and as well as a shock absorber. And several preparations are available in the market, and they are actually mainly manufactured from the rooster comb, all right, this red strip here. And so because it's actually manufactured from this rooster comb, if you're allergic to eggs or poultry products, you have to be careful, all right? So you may have to let your doctor know. Otherwise, the side effects of viscosupplementation is mild, quite transient, usually affects less than 10% of cases, mainly pain, swelling, heat, or redness around the knee. One thing to note about this viscosupplementation is that only some of us may benefit from it. Usually you may get if you get a benefit, usually it's just about within a month after the injection, and the relief may last up to 6 months, all right? But this is actually a very costly, very expensive. One injection may cost over, around $600 or so. And remember, most research studies, basically the benefits is rather controversial. So it's not really clinically significant, all right? So with that, I'll just pause for a while, and if there's any question, I'll try to help to answer some questions. Thank you so much.
请问在场观众有问题吗？
Excuse me, I'm taking glucon. Is this one of your recommended drug for knee pain, or is glucon not inside? Because you said two of the medication that you recommended.
Yeah. So the answer is this. As I said, there are many brands of glucosamine and chondroitin in the market. Glucon, so on and so forth. What you do is that you look at the content. Most of them, what basically is the ingredient of all this brand. Basically, is made out of mainly glucosamine or glucosamine and chondroitin. So basically, so long as it actually contains glucosamine, basically is that most of the studies has proven that it's actually there's some benefits from it, and most of the studies are actually based on glucosamine sulfate. All right, because there's another type that's available is glucosamine hydrochloride and so on. So basically is that less scientific studies are done on this. So mainly basically what we recommend is glucosamine sulfate. All right, we just stick to the scientific ingredient. All right, there are many brands in the market. We don't basically most of the studies are based on the ingredient component, which is glucosamine sulfate.
Okay, may I ask, with long-term consumption Is there any side effect?
Yeah. As far as we know, at this point is minimal. All right, no.
No,
All right,
thank you.
Not to worry.
Hi, doctor. I'd like to find out from you. How about taking the hyaluronic acid powder instead of the injection? And is there any studies on MSM? Yeah, these are two questions. And the third one is that what happens if you have a degenerative metatarsals? What can you do with it?
Sorry, what is the last question?
Degenerative metatarsals. That means your toes, degenerated in the X-ray.
Yeah. So, so basically is that the powder form and so on basically is the same, but the powder form basically most of the time one packet is already 1,500 milligrams. All right.
I mean the hyaluronic acid powder,
Yeah. So
Is
the
it
powder,
effective?
one packet is usually in the hospital where we prescribe the packet form is already 1,500 milligrams. So you only take one packet a day. Whereas the capsule form, some capsule actually comes in 500 milligrams. So you may have to take up to 3 capsules a day. All right. Now the other question is about metatarsal. Basically, metatarsal is in the foot, right?
Yeah.
The foot joint wear and tear.
That means the toes itself,
The big toe, is it?
Yeah, no, the few of the toes, that second and the fourth.
Yeah. So I think basically is that you have to look at the footwear, try to optimize it. So by optimizing basically is shoes with good cushion. Sometimes if it's really painful below, you may actually try to give a little bit of padding, may help. All right? Yeah.
So that means you say that the HA and the MSM is available in powdered form in the hospital.
Well, you have to check with individual hospitals. Basically, is that what we carry, the brands may differ. All right. So, but powder form is available.
Okay.
But
Thank you
the
very
brand may be different. Yeah.
Thank
Okay.
you.
Hi, doctor.
Hi. Morning.
Good morning. I would like to check with you, doctor, that many of the shoe companies, they advise that it's good to have good padded shoes, and some say that it's good to have hard surface. So what would you advise? Good
Sorry.
padding in the shoes
Good to have padded shoes versus
versus the plain normal shoes.
normal shoes.
Normal shoes. What is good for the legs?
Okay, it all depends on what type of legs and feet you have. So it has to be individualized. All right. Most people actually have flexible leg. That means more flexible foot. That means flat feet. All right. There's another type of feet that's more rigid type of feet. High arch feet. All right. So it depends. That one less people have. So it depends on type of feet you have and what are the conditions, and it has to be individualized. But most people, because it's flat feet, all right, more flexible, you may want to use a bit of wedge to wedge up the inner foot, all right, to restore the arch and lesser problems. But if it's actually rigid one, then the arch is actually very high already. So you might have, and the foot is most of the time rather rigid. So you may need more flexible shoes.
So how can we judge that whether we have a arched feet or normal feet just by standing and checking by ourselves?
So I advise you to see a doctor, all right, and then they can analyze it. As I showed earlier on in the picture, I'm just showing the most common type. So if the most common type basically is flat feet, so what happens is that if you look at the medial side of your foot, there should be an arch. All right, the arch, basically when you stand, the arch actually disappear. All right, and the whole foot actually rolled inwards. Okay, and if you look from behind, basically it's tilted, sideways. Yeah, or the other thing is you can look at your footprint. All right, a person with high arch, your footprint is usually very smaller, whereas the one with flat feet, you'll find that it's enlarged. All right, because that's the
Right,
feet.
right.
So yeah. So and there are other foot conditions as well. So it has to be tailored and individualized.
It's good to see the doctors sometimes.
Yeah,
and
yeah,
show
yeah,
their feet.
yeah.
My second question, doctor, is that sometimes we see that our feet is either bent inward or outward. Generally, if we wear shoes, we see over a period of time, generally it is chipped off from the side, either outside or inside. Is it a something serious problem and we should see the doctors for that?
Yeah, so if you are not experiencing much problem, then just wear a normal, comfortable pair of shoes is okay. But if you are experiencing some problem, I think it would be good, to see a doctor.
The doctor.
All right?
Okay,
Yeah,
okay,
good.
sure. Thanks. Thank you.
Hi, excuse me, we have a question over here.
Morning, doctor.
Morning.
I have a question to ask you. You know, the Ministry of Health recommends taking 10,000 steps a day to keep fit. To my understanding, 10,000 steps is something equivalent to more than 4 kilometers. I don't know whether this 10,000 steps applies to all categories of ages or just to certain group of ages. You see. To senior like us, taking 10,000 steps is very challenging, and will adversely affect our knee joint also. So I want to ask you, what is your view and your opinion over these 10,000 steps to take?
I think again the answer is it has to be tailored and individualized. You also has to look at your underlying medical conditions as well. All right, because other than what we have discussed today, do you have any other problem? Your heart problem, lung problem, or other problems, or you have previous strokes and so on before? So it has to be tailored and individualized. And I think just a general advice is that whatever you can do now without any problem, continue doing. All right, that is the best thing. Basically, keep going. That is a best maintenance exercise, because once you stop doing, whatever that's lost is pretty tough to regain, especially as we get older. Yeah. So keep going, keep moving. All right.
Thank you, Dr. Yap, for sharing with us. I have a question. I have a knee OA, but recently I saw an advertisement, regarding the insole. You should go to an orthotic to do an accurate assessment, and then they will do a customized insole. What is your view on this? Because they actually in the advertisement they show even X-ray people with knee OA, and how by wearing that, it's just like what you say just now, that if one joint is out, it can cause the whole muscular skeletal system to be affected. So this one is, they are actually saying that they're addressing this problem by wearing a proper insole, which is customized and through an orthotic assessment.
Yeah.
Can I have your viewpoint on this?
Yeah. It depends. Basically, is that you would need it to see a person more specialized in the making of shoes, or doctors, or your orthotics or podiatrists. Basically, if you have complex multiple problems, so especially if you have experiencing some symptoms, and it's not improving, so it may be more than what you think you're having. So basically, to get a better analysis, and you're not improving with your current footwear, you'll be good, to see someone. Yeah.
Actually, I've seen a podiatrist before. She told me that every year just change a pair of sports shoes. But it didn't really work. So I'm now trying whether this orthotic is pretty expensive.
Yeah.
But I'm thinking of going to it. So that's why is orthotic different from podiatrist? According to the orthotic, it's different from podiatrist.
So basically is that how often you change your footwear also depends on how much you walk or you run. So for example, a runner, all right, a long distance runner may have to change it pretty often. In fact, maybe 2 pairs a year. All right. So if you don't walk so much, then maybe more than a year may be acceptable. But of course, as you keep your shoes longer, sometimes the quality and what I call the absorption of impact, it may not be as good, so you may have to change one in eventually. Yeah.
Okay, thank you.
Okay. Thank you, Dr. Yap.
Thank you. Thank you.